I'm here today continuing my frequently asked questions series for you. And I'm coming to you from a hotel room. I'm on a short work conference and got some real nice accommodations behind me. But the benefit to being in a hotel all by myself is that I have the quiet time to spend some time making some of these videos I've had on my mind for a while. So for those of you who've been following my channel for a while, I have about like 28 videos now chronicling my recovery from a pelvic organ prolapse repair surgery. After my last and final baby, I found out at about 3 months postpartum that I had cystocele, bladder prolapse, rectocele, which is prolapse of your rectum. I had enterocele, which is prolapse of your uterus, and I also had vaginal vault prolapse, which is your vagina has collapsed. So to fix all of that, I went with a surgeon who did native tissue repair, and in that process I had a vaginal hysterectomy. I had my vaginal walls were reinforced with internal stitches on mostly the anterior side for me. They can put those stitches on any side, but my cystocele was happening on the anterior kind of frontal side of mine. I had a sacrospinous colpopexy, which is where they take your vagina, which has collapsed, stretch it back out as it should be, and tie it to your sacrospinous ligament near your tailbone. I also had repair for my absent perineum, which my perineum area had been pretty much destroyed during my first delivery, which was 12 years prior, by having to have like a 4th degree episiotomy, the use of forceps in a vacuum. It was a very rough delivery, and I had just kind of been a mess ever since. Also, since that delivery, I had been suffering from a pretty bad case of stress incontinence. So while he was in there doing that, I also opted to have a mid-urethral TVT sling placed to treat my stress incontinence. So that was just a very small piece of mesh, pretty much the size of a piece of Scotch tape. That is a porous mesh that eventually melds with your own tissue inside there, and is just in place to hold up my urethra. So this frequently asked question that I am addressing today is one I get from many women, usually through email, and they are saying, I'm going for a consultation with a surgeon. What should I ask them? What questions should I ask? And the first thing that I always do is direct them to my video that's on here that's called How to Choose a Surgeon. I think that would answer almost any question that you could have, or any question you should ask your surgeon. But because people maybe haven't found that one yet, I plan to link it to this one. But a couple of questions that I would say I would ask my surgeon would be, what am I having done? Like, what procedures am I having done? And I would ask for a sheet that describes and explains those. So when I left my surgeon, I had a list of all of the types of procedures that he does, and he had taken a pink pen and a highlighter and highlighted the ones I had done. And for instance, the sacrospinous colpopexy, I have never heard of that, right? I could have Googled it, but his sheet had a definition of each one underneath it that told me what that procedure entailed. So you should definitely leave your surgeon's office knowing what type of prolapses you have, what needs fixed, what the names of the different procedures and techniques that he's going to use to fix those are. I think that next you should know, how's he doing it? Is he doing it laparoscopically? Is he doing it vaginally? Is he using a Da Vinci robot machine that is essentially doing the surgery for him? He's just guiding the machine. Maybe an old school doctor might actually going to be like, cut you with an incision and do this. How are they getting in there to do your repairs? Next, I would want to know specifically, how are they doing those repairs related to mesh? Because 20 years ago, even 10 years ago, many doctors were going in and putting a lot of mesh inside women. You know, if you had a cystocele, around the year 2000, they were going to take a piece of mesh up inside your pelvic floor, essentially, and they were going to put a piece of mesh that was going to act as a sling to hold all of that stuff up in there, to resuspend your bladder where it should have been. Well, you've likely heard on a radio commercial, the TV, something where women are being encouraged to sue those doctors, that they have a medical lawsuit on their hands because of the damage that that mesh is causing. I believe it was on Netflix. It may have been Amazon Prime, but there is a documentary out there. I can't even remember the name of it. I feel bad not looking it up before I got on here, but it's like a 2-hour documentary where they interview a bunch of women whose lives were like ruined by mesh, a variety of complications. Like that mesh was going in there and causing really bad infections. It was melding to all of their tissue in bad ways and causing their like organs to grow together. Painful sex for their partner. Their partner's penises were getting cut by mesh that was up in there that was like rough, really like pokey, almost like a metal screen on a window mesh. To my understanding, doctors today are not using that. So if you have a doctor who's going to use mesh, it's likely a safe kind that's been redesigned and re-FDA regulated. That being said, the newest research shows that the least amount of mesh that can be used is best for you long term, to prevent complications, to prevent what we don't know is going to happen down the road. Like, okay, we have new kinds of mesh, we think they're safe now, but I'm sure they thought the mesh they were putting in women in the year 2000 was safe also. So I just think the less mesh, the better. So the first consultation I got with a urogynecologist, she told me she was going to go in and do a short 45-minute procedure. She was going to just put a sling in there. At this time, she only had identified that I had a cystocele because she did a ridiculous exam, like a 30-second exam. She did not check for anything else. And when I finally went and saw the surgeon I ended up going with, who is world-renowned in his field, people fly in from other countries to have him do their surgery and to have him fix mistakes of other surgeons. He did a thorough exam, including a variety of tests and a thorough physical exam with his hand, and was able to determine that I had a lot more going on than just a prolapsed bladder. So I thank my lucky stars every day that I did not go with that first surgeon, who would have probably just botched me up more. So there are still doctors trying to use a lot of mesh, and that's why I say ask about that, because she was just going to put a pretty good sized sling in there. And they compare them by saying if a doctor is going to put a piece of mesh in you that is the shape of a smile, it's too much mesh. My doctor, to fix my stress incontinence, did a piece of mesh that is called transvaginal tape, TVT sling, and it is the shape of a U. So it's small, like this. So you want to ask about mesh. If they are just going to go in and tack your organs up with mesh, you're wasting your time. You will be back on the operating table in a couple of years, 10 years maybe. I don't know, maybe you'll hold out for 10 years. But you also don't know what complications you're going to face down the road. You may have a quicker recovery right now, but you're also going to have a lot more restrictions placed on you because it's not native tissue repair. You've got mesh up in there that gravity is going to have an effect on. And when one thing prolapses, another thing likely does, and another thing does, and it just becomes a pile of prolapsed organs. So ask about mesh. I highly recommend no mesh or only very tiny TVT, transvaginal tape mesh, which is like the size of a piece of Scotch tape, very tiny. Another thing I would ask is, what is your recovery going to be like? When you wake up, what will you have? How long will your surgery be? Will you stay overnight in the hospital? Truthfully, if you have as much going on as I did, you should be doing an overnight hospital stay for sure. If not, they're probably just using a lot of mesh, and you'll have a little, outpatient surgery, you'll go home. Mine was almost a 4-hour surgery. It was very invasive. I woke up in the hospital. I stayed the night in the hospital. I didn't go home until 24 hours after my surgery. They were watching me. I had to get a shot in my abdomen to prevent blood clotting. Like, they really took my surgery serious. I was at a large hospital in my area with an anesthesia team. And I mean, it was like a real surgery. And honestly, if you're treating these things correctly and you have multiple prolapses, yours should probably be a serious surgery too, not a little outpatient procedure. Ask what you're gonna have when you wake up. So what I mean by that is I woke up with a Foley catheter. So that's like what you have when you are having a baby, you get an epidural, and they put that Foley catheter into your urethra to just keep your bladder draining at all times into a bag. So I had that, but the next day when I was going home, that was removed. I also had a suprapubic catheter, which was coming out of the front of my stomach. Basically, it was a tube that had been, if this is my bladder, they poked this tube into my bladder. It had a balloon on this end of it, so it couldn't come out of my bladder. And then it came out of my skin between my belly button and my pubic hair. And that was in place because of me getting my TVT sling. Again, that's the right long-term fix for stress incontinence, but it's a much more difficult recovery right off the bat. So I had that in place for about 10 days to help my bladder drain while my body got used to the tension, the pressure of that tape. And what I mean by that is, if this is my urethra, the urine comes down from here, they put a piece of tape to hold it up like this. And that tape has tension and pressure. Good surgeons put the right amount of pressure. That's not too much, that's not too little. But your muscles of your urethra have to train themselves to push the urine past that. And it takes some time. And it took about 10 days for my body to fully be able to empty my bladder without me having to drain that catheter. So that was the purpose of that. So you just want to know that, you want to know what kind of catheter, what can I expect when I get home so you can read up on it. I wanted to read up on what was a suprapubic catheter because I had no idea. So I looked up photos of it. I read about it. I learned how to take care of it, keep it clean while I had it, all those different things. I have a post-surgery tips and tricks video, that if you're gonna have a suprapubic catheter, I highly suggest that you watch, because I just learned some things the hard way the first few days of having that, and I give you some tips and tricks about just making it easier, more comfortable, easier to drain, easier to shower with. It's not a fun thing to have, so you wanna know about that. The next thing I would ask about is, are you gonna have stitches on the outside? I knew I was gonna have stitches on the inside because I knew that they were gonna reinforce all the sides of my vaginal wall. Totally expected that. No one ever talked to me about that I was going to wake up with hole-to-hole stitches on my perineum. I had that once before with my 4th degree episiotomy, vaginal delivery, 13 years prior, 12. But he told me that once he got in there and he knew that I had pelvic floor issues, and that's likely what was causing my prolapses, he said that my perineal area, my pelvic floor was just destroyed. I had no muscle tissue there, no integrity anymore. So he essentially described that he stitched up and reinforced the inside of my pelvic floor, all of that tissue, as well as cut the outside and pulled it tighter and stitched all of that again too. And I just didn't expect it. And to be honest, it probably was on my sheet. Like, it was probably called something. Colporaphy is, I think, what it's actually called. But I didn't know what it meant. And I guess that wasn't a big concern in my mind, but that was a bit of a surprise to me and very, very uncomfortable. I would ask if you are going to be going home with vaginal packing. You will likely have vaginal packing in the hospital. I did. I had some vaginal packing that was in there when I first woke up, and the nurses took some of that out. But they left a lot in there that I had to leave in for 7 days. So I had what actually turned out to be over 6 feet, more like 10 feet. It's in one of my videos, my recovery day 7 video. But that packing was incredibly uncomfortable, but it needed to stay in there because, again, he stitched all of the sides of my vagina, but specifically a lot of work on my anterior vagina. And as your body tissues heal, they will often try to like meld together. They try to grow back together. And so the packing was in there to prevent those the vaginal walls from touching each other, from collapsing onto each other and kind of like melding. So the packing kept them apart, kept that vagina open like you would want your vagina to be, and also helped keep it clean and prevent infection because the packing is soaked in some antiseptic stuff. So again, you can hear about all of that in my first week recovery. The packing was not fun. When I went to remove it, I could not believe how much was in there. Like, I was curious, so I had my husband come stand there and I held it up to his height, which is like 6'3", and there was more. So like 9 to 10 feet of packing inside my vagina, which explained why it was so uncomfortable. But you want to know if you're going home with that. The last thing that I would say to ask about is whether or not they're suggesting a hysterectomy. Obviously, you don't need to ask about this, but it was suggested to me, and ultimately I had one, that I would have a hysterectomy along with this procedure because hysterectomy would prevent future prolapses because you remove those organs, then you've removed something that can fall and then cause something else to fall. And I was pretty sure I was done having babies. I was only 3 months postpartum, but we were pretty sure he was my last one. So he said, if you're done having kids, you may as well have a hysterectomy. That's gonna decrease the chances you'll ever be back on my operating table. Why have periods if you aren't gonna have a baby anymore? You're removing organs that can cause cancer. We're gonna leave your ovaries, so there's not gonna be any hormonal impact. Let's do a hysterectomy. And although I was very surprised by it, I had never thought about having one. My husband was gonna get the snip. We decided, okay, we'll do the hysterectomy. But that is the one thing that I had done that I do have my regrets about. I wish that I would have just had him fix my issues while leaving all my girl parts intact. And even if that meant I went back for surgery again 5, 10, 15 years later, I wish I had left my uterus. They took that, my fallopian tubes, my cervix, because even though they left my ovaries, within 18 months, I was in ovarian failure. And that happens to 15 to 20% of women who have a hysterectomy early on. I was 37. Because your ovaries are no longer connected to the hub of your reproductive system, which is your uterus, they kind of don't have a purpose anymore, and they know that. Yes, they'll continue to release an egg into the random cavity of your abdomen, but they are not connected to the reproductive cycle. There's no blood flow to them anymore, so they just shrivel up and stop working. So that happened with me, and now I'm 3 years post-surgery, and I am pretty much in full-blown menopause. I'm not even 40, and I have been on a hormone regimen for about 18 months. And it's been a trip. Like, I don't think that God's plan was for us to go through menopause while we have like a 1, 2-year-old at home, a 4 or 5-year-old at home. I also have a teenager. You're not supposed to go through it when you're this young. So it's been a really difficult road. Those symptoms, all of the testing, trying to figure out the appropriate hormone regimen. I got a lot of videos about this too. I do encourage you to do your research about perimenopause, menopause, the effects of a hysterectomy, the importance of hormone therapy. So many women are misinformed about hormone therapy. They still believe a flawed study that came out in 2001 or 2 from the World Health Organization that said that if you took hormone replacement therapy, you were going to get breast cancer. That is not true. And if you do not do hormone therapy as you go through menopause, you are at like 50 times risk of cardiac disease, early onset dementia, and osteoporosis. And heart disease is the #1 killer of women in the United States. It's not breast cancer, not even close. It's heart disease, heart attack. Yeah. And your body needs estrogen. Even if you take no other hormone, when you start going through perimenopause and for sure menopause, you need estrogen. Do your own research, listen to my videos. I've got one called Reconsidering Hysterectomy. I've got a couple in my playlist called My Hormone Journey, but I don't know. I'm just like on a women's health advocacy mission now. I want women to know they do not have to live with the symptoms of prolapse. I want women to know they need to find a good surgeon who does this correctly. I want women to know that my recommendation would be to avoid a hysterectomy until you are like really close to natural menopause, which in the United States, the average menopause starts at 52. The average perimenopause, it's coming, menopause is coming, starts happening in your mid-30s. So women, if you're in your mid-30s and you're feeling crappy and tired, maybe you've got joint pain, headaches, you don't feel like yourself, your skin is dry and brittle, your makeup doesn't work like it used to, you're dry down there, you feel irritable and angry, you feel like you have brain fog, you can't remember your kids' names, you probably have low estrogen. So it's a good thing to talk to your doctor about. Got to find a good one to talk about that too, though, because they'll try to dismiss you. They'll tell you, you just need birth control. You need an anti-anxiety, antidepressant medication. Oh, your hormone levels look fine. But this is not a hormone-based diagnosis. It is not based on your levels. It has to be a symptoms-based diagnosis because hormone blood ranges are just really, really wide. They're the same for women who are 14 as they are 85. And because hormones fluctuate the whole time of your cycle, you could be hormone deficient, but it looks like you're okay because they tested you at a time of the month when your hormone levels are naturally low. But that's a time of the month that yours should actually be high, and they're not. So very confusing. I'm kind of rambling on a lot of topics. Bottom line, those are the questions that I would ask a surgeon to determine if he is good or not, and whether you want to go with him, and just be prepared for your surgery. I'd also ask about pain medication, because if you are having anything close to what I had, you need to come home with something. I came home with Oxy, Contin, or Codone. I don't remember which one. I will say it made me nauseous if I hadn't eaten, and it definitely made me tired. But I tried to be a trooper and not take it my second day of my surgery. Big regret. Do not let that stuff wear off your first few days. You need it. You will feel like you have a hot, fiery poker down there. So if you're having, like me, you need to come home with something, and don't try to be too tough. Just take the medicine the first few days. Get through it, then you can switch to ibuprofen or whatever, but that too. Okay, as always, please like, subscribe. It helps other women find my channel. Secondly, there is an email you can reach me at for questions. It's on my channel bio description, but it is personalprolapsestory@gmail.com. I try to respond to you pretty quickly. I'll answer any question. I've set up phone calls with some women because there were too many questions to answer via email, and it really is my mission to help as many women as I can and give them the information that I didn't have. So good luck. I hope that you are able to find a great surgeon. If not, I will happily send you my surgeon's contact information through that email.